Hello, I'm Dr. Craig Escude. Welcome to Medical Monday. You know, when we think about somebody who might have pneumonia, we often think about shortness of breath, coughing, fever, maybe some chest congestion, those types of things. But sometimes you can see other types of behaviors that could be associated with that might be the first thing you pick up on, especially if a person can't communicate with you verbally and tell you how they're feeling. You might see a person who appears very, very tired, who appears maybe withdrawn, is less interactive. You might see falls because if the person is not breathing well, they may not be getting enough oxygen. That can cause some dizziness. You could see increased irritability. I mean, anytime any of us are sick and feeling bad, we might be more irritable, we might be more agitated. You might also see a change in cognitive status, a change in a person's ability to think or to interact in the way that they usually do. That could be a sign of a lot of things, but you couple that with some of these other things, and it could be a sign of a lung infection, of pneumonia. Something else you might see is that a person refuses to lie down to sleep. And the reason for that is if they have infection in their lungs and they lie down, and this infection might spread a little more, cover more area or fluid in the lungs. You might see this with congestive heart failure as well too, where a person doesn't want to lie down. They prefer to sleep sitting up. That could be a sign that they have some sort of lung issue going on. And we need to think about those types of things whenever we see these types of behaviors. So again, pneumonia, typically you're going to see fever and coughing and shortness of breath and wheezing and those types of things. But there could be some behaviors that you could see as well, because sometimes, people with disabilities present differently with common medical conditions. So keep those things in mind. Some behaviors you might see that could indicate pneumonia or some other significant infectious process. Thanks for joining us, and we'll see you again soon.